after they just previously fell on an outstretched hand. They are having some pain in their wrist and they already had an appointment, so they are hoping that I can help fix it. Our office does not have any x-rays. So upon examination, I come in and I would to clear the scene, make sure that there is no objects in the way, and so that I can properly administer care. I would provide PPE. If there was any blood, I would put on gloves. During COVID times, I would have a mask on. So I would examine the wrist. For instance's sake, it's the patient's right wrist. So I would examine the wrist and I would palpate crepitus, and along the distal radius, there is swelling, bruising. I would have the patient slide this up so that I can see. There is bruising. I would instruct the patient that I would probably want to get an x-ray, so I will brace it and then I'll send them off to the clinic. So I will use a SAM brace or SAM splint, and I'll place the patient's shoulder in there lightly. I will wrap the splints. Ask the patient to raise their hand if they can. Okay, forward. Does that feel supportive to you?
Yep.
Okay, I will check their pulse, capillary refill, make sure they still have a pulse in their wrist and their radial wrist, and then, thanks for the help. I will ask them to wiggle their fingers, make sure that they can still do that. Movement in their fingers, all of them. Okay, and then we will brace here. So this, and go in the front. So I'll place this underneath. May I ask you to raise your hand, please? Okay, lower it. Place that together. Okay, and then this will be placed on the back of the patient to add extra care. Over the shoulder. How does that feel?
Spectacular.
Okay, and then I will again check capillary refill. Can ask them to move their fingers. Okay, and check pulse, make sure it's that. I'll instruct the patient to go to either the emergency room or the doctor to get an x-ray, and then we will go from there.